right. So, welcome to the Take Your Health Back Now podcast. We're going to talk about some pretty specific things this week. So, if you're struggling with focus, motivation, brain fog, concentration, all these things kind of tie in together and really add to each other. And these are big complaints and really common symptoms that we're seeing right now across the board, like all ages, men, women. So we're going to dive into those and kind of where they stem from and a little bit of what you can do to help reverse those and stop them from happening again in the future. If you're not experiencing them, you should still do these things to stop them from happening in the future. All right, so that is what we'll chat about today.
Right. Yeah, we see this all the time. We've seen this for many years, decades. Even when I was sick, if you know the story, how we got into this journey in the first place, when I was really sick, brain fog, and I know Jenny remembers, was one of my biggest issues. I had brain fog so bad. It was amazing we got any work done. It was all because of Jenny. But
it was one of those things that, like, I don't know, in the moment it didn't seem that awful, but then like after, and you're kind of like, oh yeah, that was definitely happening.
I know it was awful. But I mean, that was when I was in my early 30s, mid 30s. But we see people, almost everyone that comes in our office, I would say 90% of the people we work with have brain fog, concentration issues, motivation issues. And we're talking kids. I've talked to kids recently, and kids, it's getting more common in kids that we've talked to anyway. And then adults, men, women, ages young, 20s, early 20s, people are having this all the way up until, the older years. So anyone can get this, anyone is getting this, and this is a very common chronic symptom that people are experiencing.
Yes. And, Kendra and I are kind of dealing with this from a higher, like we see it all the time across the board. We are the experts in, reversing chronic disease, preventing future dysfunction, really helping people build that foundation of health to live that preventative health lifestyle for the rest of their lives. So we see it from kind of every description and every angle. And I've noticed recently that a lot of people are now going like, oh, that's what that's called. So I feel like in the past, it like with the older age group, it was just, oh, I'm getting forgetful because I'm aging. And with the younger age group, like, 20s, 30s, it was, oh, I have mom brain, or we're just so busy with work and the kids. That's just what this is. So these are like the symptoms that get put off onto other things as just normal.
Right.
And then once you kind of explain it to someone, they're like, oh yeah, I definitely have that.
Right. Exactly.
Yeah. So it is something that we're seeing people be able to kind of verbalize a little bit better. So it's probably something that people have been having for quite some time. We're just now seeing people able to, look at themselves and see that they have these symptoms.
Right. And it's brain fog is becoming more of a common term that people are, like leaky gut, people are starting to become familiar with that term and generalize what it is. So brain fog the same way. And yes, you're exactly what Jenny just said. It used to be that people were like, oh, just getting older. Or then people worry about too that, they have people in their family that have dementia or Alzheimer's, which I'm sure a lot of that is misdiagnosed and it's actually reversible and just brain fog. But they're afraid that they're going to get it. And that's a terrible state to get into when you can't, you finally get to the point where you can't turn it around. It's awful. And especially awful for all of the family members, the friends, family around these people. But so it's a scary thing to have this. And I'm just seeing a lot of people they're trying really hard at work. They're trying not to let anyone know they have this. They're having they don't feel on top of it like they used to. They're struggling to do the work that they used to do, to stay concentrating on it, to stay focused on it, to even remember. Or, I've had people say that they'll have a coworker come in and say, hey, remember that thing? And they're like, no, or, and they have to write everything down so they do remember it so that they can pretend that there's nothing wrong. There's a lot that goes into this, into people's lives in order to deal with this issue. And it becomes very stressful for people to deal with. Also, a lot of kids I've talked to lately, it's, I think a lot of them are being misdiagnosed probably with attention deficit disorder, which also plays into this as well, but we're not talking about that today. But they just can't concentrate. They're sitting there, they can't concentrate, they can't pay attention to what the teacher's saying, they can't remember, teacher calls on them, they can't retain or remember what they're supposed to be saying. And it's not just kids, adults are feeling the same way. We've had adults that just get disoriented, they get lost, they're out driving around and all of a sudden they're like, where am I going? Where is it?
And this is not just like, oh, I walked in this room to grab something. What was it? And you just kind of momentarily forget and then you remember. This is much more extreme than that. Like you are literally in the middle of Target and can't figure out how to leave the store. Like like things like that. And it's scary. And like Kendra said, a lot of times it'll get misdiagnosed. And it's one of those areas where yes, you do have a lack of attention, but that's not the disorder that's causing these symptoms. So it's like the symptoms are the same, but what is the root cause? And unfortunately, conventional medicine doesn't look for the root cause. They just look for a way to mitigate that symptom. So then you're just going to be medicated. And those medications for this area of symptoms are terrible. They're terrible for you. They might help you focus, but the side effects that they're causing are pretty extreme. And they're also long-term. Like there's no, this is going to solve the problem for you. And then in 6 weeks, we'll take you off it and you'll be better. No, you're going to be on this forever. And you're going to have to keep increasing the dose because now not only is that root cause still there, now you're adding in all these other toxins. So your body burden is just exponentially growing.
Right. Yeah. And the side effects of the medications can be what's causing this brain fog in the first place. Basically what Jenny's saying, adding to that. Yeah, it's just a crazy cycle. And this is kind of a little bit off topic, back to the ADHD thing. But, when we started this 20 years ago, 15, 20 years ago, Ritalin was such a big drug of choice for children with ADHD, but it was on the top 10 cancer causing list. Now there are other drugs of choice that are similar to Ritalin that they're using. And I'm sure they're still using Ritalin as well, but yeah, they're terrible. They have all kinds of side effects. They're adding to the dysfunction of the body, which is causing all of the cognitive issues. It's crazy. And then the other crazy thing is, the big crazy thing is all of this, the lack of motivation, concentration, focus, the brain fog, even ADHD, OCD, all those kind of things, it's all preventable.
Right.
Now, if you were doing the right things in your life with your environment, your nutrition, you wouldn't have it in the first place. Nobody would have it. And then the second thing is, if you're experiencing these symptoms, it is 100% reversible.
Right. Like these are really, really lifestyle issues. Like
Right.
there is very little that you can even go outside of that statement to improve. They're lifestyle issues. And they're lifestyle issues that in general are fairly quickly resolved if you jump into a lifestyle that supports health and you do that, then these are the type of issues that are fairly easily resolved. And the flip side of that, these are the kind of issues that fairly quickly crop up when you are not living that lifestyle. So if you've been, if you do something for a really short amount of time and you're like, these things are resolved, and then you just go back to your standard American diet, your high stress lifestyle, 6 months down the road, they're going to come back.
Right.
Yeah.
And anyone with these issues, like everyone that we work with, myself included, all those years ago, you have these cognitive issues, but you also have many other issues going on. So it's always and a symptom, an issue in addition to lots of other issues that we see people come into us with. So we have people, they're experiencing floaters in the eyes. They're having all kinds of GI issues, pain, joint pain, unexplained pain, muscle pain, just all kinds of things, you name it. But then in addition to that, one of the symptoms happens to be these, cognitive issues. So again, we say this all the time, but it's it's true. The underlying root cause of all of those symptoms is the same. So when you take that holistic, broad-based look at the body, fix the root cause, the big root cause, all the symptoms go away, including the cognitive issues. And it really just comes down to whatever, metabolic dysfunction is going on in the body, which is causing inflammation, which is now causing these chronic cognitive issues in people, including children. And I'm sure that, much younger children are experiencing this as well. We just don't get to talk to them as often, let them verbalize exactly what they're experiencing.
And it's kind of frightening because these are the types of issues that, okay, there's a couple things. One, very few people seek help for just these symptoms. And these were usually like a precursor to those other symptoms. So we see people with major GI issues, with major pain issues, with other major acute issues. And then if you go back, you can see that these were the kind of things that were cropping up and your body was saying, hey, hey, hey. And you either ignored them because it wasn't a big deal, or you were told that these are, this is a mental disorder. This is something just in your brain. It's just, take this medication to cover it up, and nothing metabolic or lifestyle was ever looked at. So that's a big issue. And then the scary thing is people are experiencing this younger and younger and younger. We're going to get to a point where this is normal. Like people are going to grow up with this inflammation and these symptoms and not realize they're having them because they've never lived without them.
It's kind of where we are, really. If you really start talking to people, I would say the majority of people, a very big majority of people, are experiencing these, one way or the other. So you may feel like you have brain fog. It's just a little slow remembering what you want to remember. Some people, it's just taking that word that you're trying to say and you can't quite remember it to get it out. You know what you want to say, but you can't quite get it out. Other people, it's just, you literally can't remember what somebody just told you. It's different for everybody. But it seems to be one of those symptoms that people can, because they don't quite think of it as a symptom, big symptom, like Jenny was just saying, they power through, or they come up with little tricks to work around it so people don't notice, to get through their workday or that type of thing. Or kids are just labeled as, they don't pay attention. Why can't you pay attention to the teacher?
Yes.
Can't you sit still in class?
We're seeing such an increase in not just the ADHD side of things, which is, that lack of concentration, that lack of focus, but like the inflammation and the brain fog contributes to your learning. So we are also seeing a huge increase in kids that need an IEP, kids that are failing grade standards, kids are getting held back. Like we're seeing this kind of decline in overall academics. And this starts this way, and we've talked to kids that are like, I know that I should want to do these things. Like, I want to be a good kid. I want to be good at school, but I just can't make myself, or I just can't figure it out.
Right. And then on the flip side with older people, it ends up being, well, it's early onset Alzheimer's or dementia or something like that because of age. And we've seen this over and over with older people turn around too. It doesn't really matter the age. And with kids, again, my story, and this is one of those topics that's very near and dear to me because it was so awful for me. And it was really a big part of how we got into this. But for me, I was always in all the advanced classes and picked, out of the whole county to do this, IQ, blah, 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 all that kind of stuff. But then I had a snowmobile accident, and almost overnight, because of that, probably the physical stressor coming in, and my body was already overburdened. I went from that to having this severe brain fog where I couldn't remember anything at school. I couldn't process anything at school. My grades went from being really great to terrible because I just couldn't do it. And I know that so many kids are like that. And then adults, the same way. And we've seen some cases. We had a case, it's a podcast from 4 or 5 years ago. One of our patients that we worked with, she was in her early 40s, and she went in and she had to have the DPT shot. Is that what it is? What's the one they put 3 in together?
Yeah, well, that's part of it, because it's like DTaP, because it's like
Oh yeah,
diphtheria, pertussis, and something else.
right.
Yeah.
And she went in and she felt healthy, brain was clear, everything. And she had to get that for something. I can't remember what it was. And then
I think it was just like you're on the recommended schedule, and she worked in a medical adjacent field.
yeah, because she was in like a psychiatrist, something like that.
Yeah.
And so she got it. She didn't know. And almost immediately she just lost all her cognitive function. And she lived in Champaign, and she didn't know how to get home from our office. When she came to us, she was talking about how she tried to go to Target one day in her town, and she couldn't even remember how to get there. I mean, it just went from like 0 to 60 overnight.
Yeah.
And she was able to turn it around working with us, of course, but it's just that it's just crazy to think about how many people are dealing with this because finally their body's like, I can't take any more.
Right. Everybody is living like right here with that body burden bucket, and it does not take a whole lot to just send you over the edge.
Right.
Yeah.
And again, it comes down to your lifestyle, your environment. Yeah.
Yeah, your gut health is so significantly tied to your brain, which is why I feel like a lot of these types of symptoms gets labeled as, oh, you need to go see a psychiatrist, you need therapy, because it is connected to your brain function, but it's connected to your brain function through your nervous system to your gut, and they all work in tandem. Like there is no part of our body that works in a vacuum. You have to look at all of it. You really do have to heal your gut if you want to have any kind of foundation of sustainable health. But there is a lot of that stuff that goes into that. So people hear, oh, just heal your gut. And they think, oh, okay, I'll just take probiotics and I'll be better. That's not how it works. You have to address all of these things that are coming in that have caused this dysfunction in the first place. So you have to remove all of that interference. You have to create an environment where your body can get back to its natural state. And then you have to support that lifelong.
Right. And another thing, because it is nervous system, that there's the vagus nerve is one of the largest nerves in our body, and it connects the gut to the brain. And there are more neurons in that than even in our brain. And so that's the gut brain connection. You can look that up. But it does have to do with the nervous system, like Jenny said, your digestive system, these are all connected. And I have seen a lot lately of, chiropractors talking about, just bring your kids in and get adjusted, and then that goes away, but it comes back. Right. And unless you teach them, or unless they're doing the right things at that real deep root cause foundational level as well, in tandem with the chiropractic working on the nervous system, it's not going to be sustainable. You have to do that. You can't have somebody drinking, red Gatorade, eating Pop-Tarts and macaroni and cheese every day of the week, and then getting adjusted and think that that is going to be, you know, stay away.
Right.
It's always going to come back. So you have to address everything holistically. And then the other thing I've been seeing a lot of in correlation with brain fog is you know, people talking about the vagus nerve a lot more. That's becoming more common, where people are starting to recognize that term. But they're talking about things like stimulating the vagus nerve to get you out of, you know, the autonomic nervous system. You're either in sympathetic state or parasympathetic state, and sympathetic state is where you don't want to reside all the time, where most,
It seems backwards.
but you know, I hear these experts talking about, you know, just focus on the vagus nerve, you know, singing really loud, screaming, gargling water, things like that do help the vagus nerve. But again, you have got to do that foundational work. You've got to look at your nutrition, your environment, healing the gut, all of those things that play into the metabolic health of your body if you're going to turn this around and have it sustainable.
Right. Like all of these things that are coming up are better options than just, you know, prescription medication, but they're still band-aids. Like they might be a healthier band-aid, but they're
Right.
still a band-aid. You know, they're still covering up what that root cause was in the first place. And you have to think about, like, your body's made to be healthy and to keep you alive. So what is its natural state? Like, is the natural state of a human to have to scream really loudly and gargle every day in order to be healthy? Probably not. So, you know, you have to kind of balance these things. Like these may be supportive while you're on your journey to getting to that foundational health, but they aren't long-term solutions in and of themselves.
Right. They're just additional.
Right.
You know, it's kind of like we always talk about your house. If you are building a house, you're buying a house, you need that foundation to be strong in order for everything to be strong. And if you build a house without a good, strong foundation, you're going to have cracks in the walls, cracks in the ceilings, your windows are going to be falling out, you know, that kind of thing. And all of those extra are things like, you know, gargling and screaming for your vagus nerve and chiropractic adjustments for the nervous system and all of that. You still have to have that foundational piece.
Right.
And the foundational piece, you know, we talk about this all the time, and it sounds simple when we talk about it, but it's actually very in depth. So it's, you know, you have to focus on the metabolic dysfunction that is now happening within the body to cause these symptoms. That's the only way to eliminate the symptoms. But then also, in addition to that, you have to address what caused that metabolic dysfunction in the first place. So you have to do both of those, and both of those are really big. But if you do that, you can reverse it.
Yeah.
And prevent. And the whole idea is we always want to teach you guys how to you know, generally anyone listening to us is having symptoms.
Right.
You to understand that you can, you know, turn this around for yourself, and then, you know, show you how to do that. And then also, then moving forward, we want to be able to prevent it for, you know, future
Right.
generations.
Yeah, in our private practice, we really focus on reversing. Like those are the people that have acute symptoms and chronic symptoms, and they're just a mess. And they really need that support and that guidance to get them over that, you know, initial change, build those new habits, have that knowledge that they need to keep this, you know, keep reversing the symptoms till they get to the point where they are actually a healthy body. But we want people to kind of learn prevention before they get to that point. You know, we're happy to help those people, but our ultimate goal is to have this kind of, you know, like innately know how to live healthy from a young child. So that side of things, we really move forward with our preventative health practitioner training. We're trying to get all kinds of people kind of on our team that can go out there and train other people how to live this way. And that sounds really boring. Like, why do I want to be trained to be healthy? But it really is. Like, we are not taught from a young age. We don't have good, you know, like role models of foundational health. There is no, you know, you go to school and you learn about like the food pyramid And I don't know, like health class, what do they even teach now? I don't even know if they're allowed to teach anything in health class.
Right.
So how to not be sweaty. It's pretty basic. Like you don't get these concepts of real foundational health, and you're not taught what in your environment is adding to dysfunction. We're just kind of marketed to for money. And that's the big thing in most of our lives is convenience and money. And health is not really spoken about. So that's kind of off topic, but
Right.
that is our preventative health practitioner training if you are interested.
Yes, teaching our proven system to get the same results that we get with our patients. But it is, this is kind of off topic too, but with this time that we're living in, it seems like, there's more and more focus on chronic disease and the fact, what is causing chronic disease and the fact that it really is ultimately preventable. And so people are becoming more aware, and they're becoming more aware of the words, like we were saying in the beginning with the brain fog. People are understanding what that word is and what it means. But what's happening is there's more and more experts out there, and there's more and more influencers. And then people, like I had somebody I talked to yesterday, and she said, I'm becoming more aware. I want to, turn this around for myself and then prevent chronic disease in my future. But I don't know which experts to listen to, because this one's saying this one's saying this. There's all this conflicting information. And then she's like, I don't know who's an expert, and I don't know who's an influencer. And there's just, even though there's more awareness, there's more confusion right now. And the only reason I thought of that is because I was thinking about the PHP program, because there is a necessity for people right now that truly know the real way to turn this around for people, be able to help them, because a lot of it's just kind of, people have a good, they want to help people, but they're jumping on the bandwagon, and they're maybe shot in the dark, reaching for straws, the Band-Aid fix. There's just so much.
And like we were talking, we've touched on over several things, in the conversation about how you may do this one thing and get short-term positive change, but it's not sustainable. So I think a lot of times these people, like you said, they have good intentions, but what they do is they take their very specific experience and they say, this is what I did. If you do it, you'll have the same results. And the issue is that we all have the same roots, but our symptoms just, crop up differently depending on our biology, our environment, our lifestyle, our experiences, our vocabulary for expressing what's going on. So, you might try something that someone else has done and you might not see any change at all, or you might cause more problems, unless you take this really broad approach and look at all areas of your life, and look at all of those roots and address them. You're not going to be guaranteed to see that same change. So this is really the only way to see change in all areas and create something that is sustainable.
Thing with chronic conditions, chronic disease, chronic symptoms of any kind, and obviously we're talking about brain fog and symptoms associated with brain fog today, but everything ebbs and flows. There's no, okay, I hit on something, it's gone. You'll try something like what Jenny was saying, you try this, and so you'll try it, and maybe it goes away, and all of a sudden you feel better and you feel clearer, and all of a sudden you're like, oh, that was it. I hit on it worked for me, and I'm going to do that. And then all of a sudden it goes back down and it's back. And you're like, what the heck? I didn't even change anything. I don't even know why this went back, and that's where people find themselves. And then it'll go back, and you're having some really great days, and you think you hit on something, pulled out dairy, you pulled out gluten. Now it's better, but then all of a sudden it's back. So that's just another reason why it's really hard to do it on your own,
Yeah. And with these types of symptoms, with the kind of combo brain fog, anxiety, lack of focus, lack of motivation, it is really hard to implement change or understand what changes to implement if you're trying to do this on your own. So you're struggling through those symptoms, and then you're trying to comprehend, you're trying to do all this research yourself, put something together, and stay motivated to stick to it so that you can do it long enough to see change. So these are definitely the types of symptoms where it can make significant difference if you are working with like a mentor, a practitioner, someone who is there to hold your hand and guide you and give you the program, the path, especially in those first like 3 to 6 months. So once you get there and these kind of symptoms are gone, then you're much better able to have the handle and be empowered to do that yourself. But while you're experiencing these, it's just going to be exponentially frustrating because of the symptoms you're having.
Right. And another thing to remember now. So of course, this is what we do. We would love to have you work with us, obviously. And we do have, a system we've come up with that we can help you turn it around. If you find someone else, you follow somebody, you found somebody in your area, just make sure that you are always looking. If you find somebody you want to work with and they're offering you a quick fix,
Yeah.
don't do it. It's not going to work. If it's somebody that is, a product, something like that, a supplement, kind of a surface level, stay away from that. And if they don't address your diet and your environment and your lifestyle, avoid them. If they do, then that's great. But you have to go into all of those areas. And the other thing that I thought of while Jenny was talking is, another area that we're starting to move into with health is the AI thing. So we're going to see this more and more and more, where companies are going to say, you can run these tests, functional medicine, it's very personal for you. It's these tests, and saying it's personal because you see the tests and the data that's just for you. But then AI will tell you what you need to do to reverse symptoms. And 100%, we have been doing this long enough. I can guarantee you that no AI will ever be able to look into your lifestyle and help you navigate what's causing your particular situation, because it is very personal to you, but it's kind of a misnomer that it's the testing that's personal to you. That is, but we also know what's happening with everyone that's experiencing symptoms. But really, where it's personal to you, it's where you live, it's your situation, it's your job, it's your stress level, it's what you're eating, it's what state you live in, it's if you live in a town, if you live in a farming community, you need a person, is my point.
Yeah, like in health, AI is essentially just a program, and it makes sense that a computer program would be able to look at a bunch of like a data set and say, most likely, because of past data sets, if you have XYZ data in your test, then you probably have this label. So it makes sense that AI or any kind of computer programming would be able to diagnose maybe faster than a human. But like we've always said, diagnosis is not important. Like having that label does not actually do anything for you. All that does is allow a doctor to prescribe you medication or suggest a surgery. That's really all it does. It doesn't give you any insight into what the root cause is. It doesn't give you any kind of suggestions for lifestyle change, like nothing. So that's where that human really has to come in, and that data can be information that is good to have. It can help you focus on certain areas to make change in those areas more significant or more quickly. But it's really not necessary. Like you don't have to have that data and you don't have to have that label in order to make change and be healthy.
And for instance, with brain fog, or the lack of concentration, motivation, whatever, you could type in you know, that you have these symptoms,
Mhm.
and I could come back with, well, if you have these symptoms, this is most likely what it is, and this could be what's causing it. But when they tell you what's causing it, it's going to be things more like lack of vitamin D, you know, this,
Inflammation.
right, inflammation, that type
Yeah,
of thing. And what it's never going to tell you is, why do you have the why
right.
do you have the vitamin D deficiency? Why do you have this systemic inflammation? And you know, we've had people that, we use this woman as an example a lot, but her whole issue, through human to human contact and interaction, we found out that in her home they had these crazy electrical boxes in the bedroom,
Right.
and that was ultimately what was keeping her
Or
sick
the
all the
closet of shoes.
right.
Like
Or
there are so many things. Yeah.
right, and AI will never help you with that. So this, if you really want to resolve your health, eliminate symptoms, and then prevent chronic disease, you really need to work with real people. So keep that in mind, because it's going to very quickly move to more of an AI, you know.
Right. And I think it's going to get pushed in the conventional medical system because it's cheaper for them. They can put a big investment into AI platforms up front and then down, they're looking down the road.
Right.
That really saves them money on practitioners and, costs of visits, things like that. And you will see conventional medicine, health insurance, everyone in that arena. They are pushing prevention. So you will see things like you're required to go in once a year to have, your height, your weight, your blood pressure, your cholesterol,
Check.
yeah, all monitored. And then, depending on your age, there might be mammograms, colonoscopies, all, now these colon cancer screenings, like all of these things. And it's easy if you're a good human to take that and think, oh, they're really trying to save lives. But they're not. They're trying to catch disease early enough that their cost for um, the maintenance of it is optimized. They want to optimize how much money they're making without having, they don't want people in the hospital long term because that's expensive. But they do like people taking a lot of tests and on medication long term because that makes money.
Right.
So, you have to kind of look at what is the motivation behind these prevention type things. And I think AI is going to come in and be part of that in the near future. Uh, it's not really giving you root cause. It's not telling you how to be healthy. It's just telling you how to stay in that zone where you're making them money and you're not costing them too much.
Right. Managing symptoms.
Yeah.
Anyone, that's another thing. Anyone you're looking into working with, if they are talking about managing symptoms or treating symptoms, avoid that too, because that again is that band-aid fix. And I was going to say that I wrote down purpose. So the other thing with, when people are experiencing brain fog and these issues that come along with that, not only are they struggling to keep up with their daily life, across the board, whether it's at work, at home, you know, that type of thing. It's also, you know, we all have a purpose. We should feel
Right.
like we have a purpose with our life. And you have this, you know, connection with God or source, or, you know, whatever it is for you, and your innate intelligence and your higher self. And you lose all of that because you
Right.
don't have, you can't even get to that point where you're feeling purposeful, because you're just trying to get through the moment to moment. So I think that's a big piece of it too, that we don't talk about a lot, but that is a big.
Yeah.
And, you know, maybe people don't even realize, like oftentimes when we're working with people, they don't realize that at the time they're experiencing these things, but once they get better and it goes away, then they tell us, I feel like I have purpose again. I feel like, you know,
Right.
everything's expanded for me and opened up for me. So that's just another piece.
Right, or on the other side, they still don't see it as a health condition and they end up into like extreme depression. And then they're just medicated or institutionalized for things in that arena that get even worse. And that is a terrible way to live. You are definitely not thriving. You're just surviving until you're not. Like there is no purpose to your life, and that is a terrible place to be. So it's really important to see any symptom that your body is having. Is your body telling you, hey, there's something out of whack. There's something going on that you need to address. And hopefully you notice these things when they're minor and you can get to that root cause, make those lifestyle changes, address that symptom. And if you don't, they're just going to get worse and worse and worse and worse. Whether you're noticing them or whether you're covering them up, they're still growing.
That's what I was just going to say too. So all of these little symptoms at first that pop up, anytime you have any symptoms, and of course, today we were supposed to be talking about the brain fog, focus, concentration, motivation, but any other symptoms as well, it means you're on that downward spiral towards disease. You are either going towards disease or towards health, and you may only be this far down, but if you don't do something about it, you're going to continue to go farther and farther down. And the farther down you go, the harder it is to turn it around and get back on the other side. And you always can, the body can regenerate itself until you can't. Remember, there's always a point where you can't. So if you start to see these little things popping up, just listen to it. Like Jenny was saying, like it's a conversation your body's having with you. And then you need to say, okay, I need to do something about this. And then, take action now rather than later. And you can turn it around.
Yes. And that's that tricky point. Don't just look for a magic bullet. Don't just take action to be taking action. Be mindful, be purposeful, find a person that can help you through this. Do your due diligence, make sure that you understand what their ultimate goal is. Again, most of the people that are out there in the health space are genuinely coming from a place of good intention. That doesn't mean what they're doing is going to help you. So, this is that tricky space where these set of symptoms can very easily be pushed aside, can very easily be, I'm just, too busy right now, and that's why I'm having these issues. I'm just getting older. I'm just, have too many little kids to deal with, so it's just normal. If you normalize symptoms, you're basically ignoring that conversation with your body. And you know what your body's going to do? It's going to make that conversation louder. So yeah, once you're at this point, it's easy to turn these things around. And then once you've ignored it, then it's harder and harder. And if these are your main symptoms, not only is it going to be harder physically, it's going to be harder mentally, because that lack of motivation is a real symptom. And it's hard to force yourself over that.
Yeah, and then it's harder to turn around and do what is needed to be done to turn it around, because you literally, it's not you that's unmotivated. It's literally, your dopamine levels are low,
right.
Something like that. You can't help it that you feel no motivation. That is literally your body is out of balance. So you might need someone to work with you too,
Right.
accountability to help you through that time, because you literally don't have it. And then the other thing is, just remember, even if you're 80 years old and starting to have these issues, age doesn't matter. These are not age related. These are internal body related. So, I mean, we've worked with really some people in their 80s that were able to turn around, brain fog type issues, just because they were able to balance their body. So don't feel like, well, I'm 54 years old now and it's just age and, this is just how it's going to be, because that's not true. So anyway, hopefully this helped. And definitely, we hope that you feel motivated, even if you don't feel motivated. You feel motivated to reach out to someone and get the help you need. at a root cause level, not at a managing symptoms or treating symptoms level. 'Cause you can't
Yes.
turn those around.
And if you are friends with, family with, associated with
Right.
someone who you know is having these symptoms, maybe this helps you kind of understand. It can sometimes, people can get frustrated with other people, especially like in Kendra's situation where it was just a sudden change. They're like, you didn't used to be like this. What are you doing? So, have some compassion there. And also maybe this type of information can help them and help you help them. So, share, spread the word. If you're watching us on YouTube, definitely like and subscribe. That way, anytime we post these new podcasts there, you will get notified. And then if you're listening on any kind of audio platform, subscribe there so that you get notified when those go live as well.
Have a wonderful day, everyone.
Yes. Bye.
Bye.